The development of the gonads, testicles and the ovary and related anatomy to these basic facts on like a congenital anomalies or any other problems that is arising if there is any developmental error which may produce during this process. Now, as you are going to learn this particular process of gonads development, both the testicles and the ovary as a similar type of development. Reaching to a certain point, they become different as they are progressing through the developmental process. Now, to make it simple, to look like how these things can be studied, we have two stories to cover whenever we are going to talk about the development of the gonads. So, the story 1. So, what happens is that during this time period, which is 5th week of life, we have a development which is going on, that we have an elevation on the tissues which is lying medial to mesonephric mass. Now, we have an idea about mesonephric mass because this is a kidney producing area of these intermediate mesoderm we talked about. We have 3 sets of the kidneys, pro, meso and meta. This mesonephric is like the advanced variety that we have learned. So, where this mesonephric mass was developing in the intermediate mesoderm region, medial to it, we have elevation to appear around this time frame, which is known as 5th week of life. Now, what happens over here, if we have an elevation, we give a name to it. We name this elevation as Genital Ridge. Now, if you see this particular genital ridge, which is nothing but an elevation, have got 2 parts. It has an outer part, we call them as outer part as cortex part, and the deeper part we call them as medulla. So, this genital region is a bump or elevation which has 2 parts, cortex and medulla can be divided on. Now, what happens next after that, within this genital region, the cortex, which is outer side, from the outer side to inner side, there is a development of some kind of finger-like projections. We call them as cords. So, we have a development of some longitudinal cords that develops. We call these cords as sex cords, which develops into this particular genital ridge. So, if you just like see this particular genital ridge like this as an elevation, and which grows with time, this elevation from this side we call them as cortex side to this side medulla side, we have some kind of finger like projection goes into this particular substance, and this longitudinal ridge we call them as sex cords. So, this phenomenon happens to occur to this particular medial side of this mesonephric mass. We have a bump and elevation, we call them as this as a genital ridge which has a outer cortex, inner medulla. From this cortex side to this medulla, we have some kind of finger-like invagination takes place and creates some series of cords, we call them as sex cords. So, this is a story 1 which happens. Now, next coming to the story 2, what happens other ways. So, we call them as story 2. Now, this story 2 is little bit backward in time frame. So, we talked about 5 weeks of life. The story 2 actually started 2nd week of life. Now, what happens in the 2nd week of life? We have development of a cells. We call them as epiblast cells. Now, these epiblast cells, they move to the yolk sac region and settle there. So these epiblast tissues are produced during their second week of life, and then they move to the area we call them as yolk sac region. So this epiblast tissues which has been produced there settles down to the yolk sac region, and this particular tissues or cells we call them as primordial germ cells. Once this particular primordial germ cells are produced, from second week to 5 week of life, there is no movement. They stays there, remains there. So this is another story. So story 1, we have an elevation elsewhere, and this is the second story, which you call them as formation of these primordial germ cells, which is happening here. Now, if you look at this particular picture that you are seeing here, this is a developing embryo, and the yellow one you are seeing here is the yolk sac. And in the yolk sac, we have the epiblast tissue forming over here. The red tissues that you are seeing here, these are primordial germ cell that is produced in that particular 5 weeks of life, and story there. Now, this story 1 and story 2 meets each other with time. Now, what happens? Once this particular thing we have achieved with the 5th week of life, this sex cord is produced in this region. This primordial germ cell, they get a signal that it's time, and they start moving. So this particular primordial germ cell that was settling down on the yolk sac, that sac that you are looking here, they start moving and migrating towards this sex cord region. So what do? The primordial germ cell from the yolk sac, they move to this sex cord region into this genital ridge. So they start migration of primordial germ cell, migrating from where? Yolk sac region to the genital ridge. Where in the genital ridge, they are moving into the sex cord region in the genital ridge. And how do they migrate? They migrate along the dorsal mesentery. So that red dots that you are seeing here, following there, they are moving, making a move from this particular yolk sac region, and slowly they are moving towards this particular region where this genital ridge is formed. See that red dots are moving and getting into this region. So these are all points which are saying here are MCQs for us, where this particular primordial germ cells are produced, that yolk sac region, which cell they are making epiblast tissues, and at what age they are making a movement which is 5 week towards this particular sex cord or the genital ridge region, and migrating through which landmark structure like the dorsal mesentery, traveling along, they reach there. So this story 2 meets with story 1, and once they reach to this genital ridge region, this primordial germ cell, they permeate and settle inside this sex cords. Now, once these particular things are complete, the migration is complete. So, germ cells plus genital ridge, which is found in sex cord definition, then we call this genital ridge as Gonad, gonad. So then we have this gonad form. Now what is the speciality of this gonad? This is undifferentiated. That means we do not know the sex of the gonad. It's going to be testicles or it's going to be ovary. We do not know yet. So this is what is a common for the testicle development and the ovary development. By this 5th week of life, we get a gonad which is undifferentiated gonad. Now what happens next is the different course that is happening with the course of the gonads. So then we have the next story. So before we move into, we have to understand this undifferentiated state of gonad, then we can separate out, this is going to be the ovary, this is going to be a testicles. So this is what we are seeing here, as primordial germ cells migrating fifth week of life through dorsal mesentery to this genital ridge region, populating that particular region which is known as sex cord region. Once it reaches to this particular sex cord region, which is migrated by this particular primordial germ cells, then we call this genital ridge as gonad, and it is undifferentiated yet. Now, then comes the next story, the story number 3. So, once we have this UD or undifferentiated gonad, then comes the story over here, what this gonad wants to be and tries to be or going to be. Now, if this particular embryo have the genetic map XX or XY, now story plays with the genes that directs it whether it's going to be a testicles or it's going to be an ovary. Now, how this particular thing matters? Now, if we have this Y chromosome, now with this Y chromosome, we have a gene existing to it. So, we call them as SRY gene. So, this SRY gene secretes a protein which is known as TDF, Testis-Determining factor. Now, what the TDF do? They stimulate this genital ridge region. So, if you have a Y chromosome, we have this gene and this protein substance is liberated, then the TDF is liberated, is going to act on. So, what is going, this TDF is going to act on? It's act on the undifferentiated gonad. So, if the TDS is there, this undifferentiated gonad have got two components. What component? We have this cortex and medulla. So, this cortex part of this undifferentiated gonad, if we have testis-determining factor there, it destroys, and the medulla part remains. So, this medulla part of this genital ridge, which the gonad remains there and develops and furnishes. So, then we have this particular medulla only, where the cortex part gradually absorbed and vanished. So, this medulla part of this ridge is there. Now, this particular medulla part, once this particular region of the undifferentiated gonad is there, this testis-determining factor stimulates the formation of interstitial cells plus Sertoli cells. So, they produce this interstitial cell formation and the Sertoli cell formation. Now, this Sertoli cell and the interstitial cells, they produce some substances. We call them as testosterone, dihydrotestosterone, and anti-Mullerian antigen. So, these are further chemical substance that is produced by TDF through these particular interstitial cells. Now, this testosterone, dihydrotestosterone, and this anti-Mullerian antigen, they stimulate this medulla. Now this medulla is going to become testis. Now, what happens? We have this sex cords that remains over here. So, that particular sex cords that is present in here becomes seminiferous tubules, rete testis, and within this we have these germ cells existing within it, which becomes the spermatogonial cells or primitive sperm cells. Now, this is one thing that is happening. Second thing happens here. For that, we have to go back to your learning or understanding on the renal system. Now, on the renal system, when we are discussing, we learn about two things. One thing is, we have this nephrogenic mass, which is the kidney substance that is there. Along with that, we have a carriage system. We call them as ducts. So we call these ducts which is present in here for the metanephric kidney, we call them as metanephric ducts. Now this metanephric duct is basically the pronephric duct which becomes metanephric, and later on the metanephric duct it is utilized by something which we have stopped discussing about. Now here comes the story about the metanephric duct. So this metanephric duct which was lying nearby to this particular point was now used and utilized by this testicle system. Now this metanephric duct has got two components. We have this metanephric duct and small duct, we call them as metanephric tubules. So these small ducts of this metanephric ducts, they slowly permeate into the genital ridge through this influence of this testosterone, dihydrotestosterone. So this narrow duct channels which is present in here, we call them as metanephric tubules, gets into the developing gonad and they form a part of this testicle system. We call them as efferent ducts. Now if you see that these testicles, we have these seminiferous tubules. Seminiferous tubules goes to RT, rete testis. RT goes to efferent ducts and efferent ducts becomes the vas, and after that the vas is eliminated to form this particular element, we call them as ejaculatory duct. So this is how this particular system or duct system in the testicle works. Now how this duct system works in here is that this metanephric tubules and the metanephric duct, they are utilized by this particular developing gonad in terms testis and becomes incorporated now. So this testis now gets this particular seminiferous tubules from the sex cords, gets the germ cells from the primordial germ cells, gets this efferent ductules from this particular metanephric tubules and the vas difference from this metanephric tubule itself, and they form the whole epididymis with this particular testicles. That's how this is formed. So this testicles takes two terms in formation from this particular genital ridge and unused metanephric tubules or unused metanephric ducts is also forming this. So this is what we are showing here. Undifferentiated testis which is present in here is influenced with this testic-determining factor which is coming from this particular SRY gene and which stimulates the Leydig cell and Sertoli cells and which is producing further chemical substances to become this. So this is the chart or the flow of these things happening. Y chromosome there, we have SRY gene, we have TDF distinguishes the Sertoli cells, we have testosterone, dihydrotestosterone and anti-Mullerian substance which is liberated. They transform this particular element like this. So we have this particular sex cords through this genital ridge present in here. We have this tubules which is present or coming on here, and as well as this metanephric ducts which is coming into it and forming this particular whole network system. So this is the phase 1 phase which you are seeing here, where you see these cords are there. Now these cords are contributed along with these metanephric tubules, and from the metanephric tubules we have the metanephric ducts. So we have these seminiferous tubules formed, then we have these efferent ductules, then efferent ductule joins with this particular channel system, we call them as vas difference. So this is how the whole things are there. Later on this particular tubes become canalized, becomes lumen formed in here, and this whole things runs in here, and this sperms which are produced are gone through this particular duct system and eliminated or excreted out into this particular ejaculatory duct system. So this is how this particular thing is going to form. So what we have to remember out here is that what metanephric tubules is contributing in the testicles, what mesonephric duct is contributing within these testicles and what this genital ridge is contributing. So, this genital ridge is contributing the seminiferous tubules. This particular efferent tubules is coming from this particular mesonephric tubules, and this particular vas deferens along with the epididymis, they are coming from mesonephric ducts, which is contributing these elements. So, this particular transformations of the testicles that we have to remember little bit about, where from the which components are coming into and forming into this testicle system. And the primordial germ cells that is coming or becoming the spermatogonial cells, sperms, spermatozoa, etc. later on. So, we have two different sets of things which is coming here. One is germ cells, other is the in-house system. In-house system means other than the germ cells. So, germ cells are coming from elsewhere, they are migrated cells. That means the sperms, spermatogonial cells, they are not present within these testicles when these things are developing. They are coming elsewhere, getting into it, growing in that particular part. What grows into this genital ridge is that seminiferous tubules, and that particular from the seminiferous tubules we have these rete testes. Up to that part we have developed. Rest thing we hire something as a tube system. Rest of the tubes, that means the efferent ductules and the vas deferens is hired from the kidney system, which the kidney system was not utilizing. So, this is how the whole thing makeup happens to occur if this thing going to be a testicles. That means if you have Y chromosome, this story goes to happen. Now, what if we do not have the Y chromosome? So, that means the offspring have got two X chromosome. That means we do not have a Y chromosome. That means we do not have this SRY gene. That means we do not have this testis-determining factors. That means only Y chromosome is there, and that particular Y chromosome is producing some substance and it is stimulating the genital ridge. Now, what happens if you have this Y chromosome only and no TDF? So, same thing, we have this particular genital ridge. Now, genital ridge is divided into two parts, outer cortex and medulla. So, if you do not have Y chromosome, then the reverse thing happens. What happens? In case of this particular genital ridge, this medulla part is absorbed. So, this medulla is destroyed. Nothing goes here. It is filled up with solid fibrous material. So, nothing leaves in there. So, this duct or the channel system, that means mesonephric tubules and the mesonephric duct cannot penetrate there, and they completely also get replaced. So, we do not have this particular rete testis, we do not have this particular efferent ductules and the vas deferens in the female subjects, because we do not have the TDF anti-Mullerian substances which was stimulating this particular renal system to contribute here. So, we do not have growth in this particular part where we have seen beforehand in the testicle difference going on. Rather on, we have this particular cortex only. Now, what in cortex this genital ridge had? It has only these finger-like projections that we call them as the sex cords. So, only sex cords are there, and within this particular sex cords, we have these primordial germ cells present. Now, only thing this is present, and this part is absent and not happening again because we do not have any stimulation. Now, we have this particular sex cords with the primordial germ cells. Now, what happens in here, in case of ovarial development, this sex cords also breaks. So, they break and disintegrate, and the cells within the sex cords, they form a cell, we call them as follicular cells, and these follicular cells, they form a cluster like cells. So, these particular cells which is present in the sex cords, they form a different types of cell in absence of SRY gene or TDF. So, what happens here? The sex cord breaks and becomes small islands of isolated collections of the follicular cells. Now what these follicular cells are doing, they surround around this particular developing primordial germ cell and forms this primordial oocyte. So these follicular cells, they form around or found around this particular developing primordial germ cell and form the primordial follicles, and that's how these follicles are formed, and they are present on the cortex side. The medulla side, we have only some tiny fibrous tissues and the blood vessels present. So this is happening in absence of TDF. So no TDF, the genital ridge transforms like this, goes like this, and later on, once these things are formed, it starts to secrete this female hormone like estrogen, and that particular estrogen stimulates these follicular cells to form a bigger size follicular cells and forms this particular primordial follicle, primary follicle, so on, so on. So this is what happens in case of the same undifferentiated gonads with influence of this genes which is taking place. So basically determining factor on this undifferentiated testis or undifferentiated gonad is there whether you have this Y chromosome or not. If you have Y chromosome, story goes in a different way. If you do not have a Y chromosome, the story tells you some other stories. So if you have this particular testis developed in this region because of the Y chromosome presence and TDF, and absence of TDF, this particular genital ridge behaves differently and forms differently. So this medulla part gets damaged or get replaced, only cortex remains. Cortex has got cords which breaks down into smaller cord cells. We call them as follicular cells. What do the follicular cells do? They find this primordial germ cell surrounding them and forms the primordial oocyte, which grows, becomes in the primary, secondary, tertiary, final graphene follicle like that eventually. So this is the whole story of formation of the gonads. The male subject and the female subject, they tell about this particular different entity on the different things. So no TDF or have TDF, the stories are two different ways. No TDF, that means no testosterone, no dihydrotestosterone, no anti-mullerian substance. The story goes in a different ways, and this particular element behaves different way and creates this ovum. So this element which you are seeing here before this cords breaks down, form this small ovum like this. We call them as primordial oocytes like this. This cord cells becomes or surrounds this particular element, forms the cells, we call them as follicular cells. So this is the whole story of becoming the same undifferentiated gonad to become testicles or becomes this particular element ovary. Now, what do you have to remember? Whole story, you cannot remember all the things because it's not necessary. What thing you have to remember is here is that SRY, which basically determines, which is the lead band master, which leads you to this particular element. And from the band master, the offsprings of the band master is that TDF. So these are the two things you have to carry with you. Rest of the story, you can wipe it off. The Y chromosome secretes this particular, having this gene, we call them as SRY gene. And that particular gene is the factor that undifferentiated gonad is going to be testicles and the ovary, differentiating on this protein substance, we call them as TDF, testis-determining factor. Rest thing, you can forget. You do not have to remember this whole story of formations of this particular ovary, how these things are coming on. Now coming to, once you have this particular testis formed, then you have to know the clinical thing which you are going to be tested in examination. We call them as migration of testicles. This is what you have to know. This is what you have to learn in detail. You have to remember every bit of it. Now, in the kidney development, we've seen that the kidney develops in the region, the final one is in the lumbar region or the sacral region. And eventually, it climbs up under the diaphragm. And we call them as ascent of the kidney. And this ascent of the kidney is triggered by something which we call them as longitudinal expansion of this anterior body wall or abdominal cavity. Now here we have a reciprocal or reverse change. This particular testicles which is developing in here was developing in the lumbar region, and eventually after this formation this testicles migrates or moves out and ends up in the scrotal sac. So this phenomenon we call them as descent of testis, is going down from the lumbar to the sacral region to this particular scrotal sac. So we call them as descent of testis. It develops in the lumbar region and goes down to this particular scrotal sac following the schedule. So it falls, runs into a schedule, it forms around this particular 4th week of life, the testicles becomes differentiated into testicles and is formed. Once this whole thing is formed, it starts migrating. From the 3rd month of life, it starts move out of this abdominal cavity slowly. From the 3 month, it was here in the region, we call them as iliac fossa, moves to this particular anterior abdominal wall from that region. So then it goes to this particular region, anti-abdominal wall, we call them as deep ring, which is around 6 months. Then around 8 months, it reaches to the superficial ring. That means it comes farther medially. And then just before we are born, this touches to the scrotal sac. So this descent, 3rd month, 6th month, 8th month or 9th month or before we are born, this movement of the testicle moving out of the abdominopelvic cavity to the scrotal sac, the duration that matters. So we call this phenomenon of migration of testicles as descent of testicles, which follows a number of factors. So there are some factors that is driving the testicles out of this particular abdominopelvic cavity to the scrotal sac. So number 1 factor is differentiated body wall growth, which is happening in case of the migration of or movement of this kidney as well. We have a formation of this pouch, we call them as inguinal bursa, which happened here because of this particular movement of the inguinal bursa that drags these things are there. The third and the most important thing, we have developed a tissue which is a fibrous tissue stand, we call them as gubernaculum testis. And if it is ovary, we call them as gubernaculum ovary. So this gubernaculum is a fibrous element which is anchored to the underpole of this particular testis, drags this particular testis out as this size or length of this gubernaculum shrinks. Finally, we have the factors like male sex hormones and increased abdominal pressure which pushes out this kidney out. So there are factors which is taking place, which is helping this kind of pushing this particular testicles out of the abdominal cavity through this particular movement of the series of things, body wall growth, inguinal bursa, pull of these processes vaginalis and the cremasteric muscle movement to this particular scrotal sac. So this whole movement which is natural, we call them as descent of testis. Now descent of testis may be abnormally stopped at some point or may be ill-directed, just going to the scrotal sac which is normal, but if it reversely moves out, if it goes to under the diaphragm, then we call them as abnormal movement. So there are 2 things can happen with this movement or downward movement of these testicles. One thing, it can have a slowness on the movement. That means it reaching to this particular anterior abdominal deep ring by 6 months of life, but it not reaching that particular point, but it moving slowly. So we may have a slow descent. This could be one possibility. Other possibility, it may have a different directions. It takes a wrong route. It moves to the back of the kidney side, moves elsewhere. So they may have a abnormal movement as well. Some elsewhere it may be moving. So depending on how this kidney is descending down, we have a number of cases or number of clinical problems that we are going to now on here. So the first factor over here we are going to talk about, we call them as undescended testis. Now if you go by this name undescended testis, clinically we call them as cryptorchism. That means the kidney is not descended. That means it was en route towards the scrotum but not reaching to the scrotum in appropriate time. That means it misses the bus. So it should be reaching to the scrotal sac before you are born, but it failed to reach that. So then we call them as undescended testes, but it is on the right track. It catches the right bus, but yet to reach to that. So this particular thing can happen. What happened? It can be arrested in the anterior abdominal wall. It can be arrested at this particular deep ring. It can have arrested in the superficial ring. It can have arrested anywhere between that particular tract where it should be tracking down. So we call this phenomenon as cryptorchism, failure of descent of testes. As a result of that, you may have a unilateral or bilateral empty scrotal sac. Now, if you have an empty scrotal sac, there have two possibilities. Kidney may have escaped anywhere, somewhere else, or it has jammed somewhere. If it is jammed somewhere into this particular route, we call them as undescended testes. Now, if you have gone rogue, gone elsewhere, migrated elsewhere, didn't follow the track, caught the wrong bus and take a detour, then we call this as a phenomenon as ectopic positions of Now, these are two conditions that you have to differentiate out during examination as ectopic testes and undescended testes. Apparently, it looks like the same because we are not seeing the clinical cases. Undescended testes and ectopic testes, both our testes have got not in normal position. So, in case of the ectopic testes, we find the testes in, for example, in the perineum. We find the testes on the root of penis. Now, within this particular descent tract, this perineum and the root of testis is nowhere there. So, at no point it should be reaching there. So, normal path of this particular movement of the testis is the iliac fossa to this particular deep ring, to this superficial ring, to inguinal canal, to this particular scrotum. So, if we have these testicles anywhere in this particular zone, we call them as undescended, and anything deviation from it, we call them as ectopic testes. So, in examination, if it is given the developmental question, read it carefully. If it is cryptorchism or ectopic testicles. Ectopic testicles means not in the right tract, that means elsewhere, perineum. In case of the anterior abdominal wall cavity, under this particular tract, somewhere in the sigmoid colon, likewise. And if it is undescended or cryptorchism, that means we have a problem related to a delay in the descent, then we are referring to. So, many times, like 80 or 90 times, we have seen that during examination, we write the whole story, but we did not get the difference between the undescended testis or cryptorchism with the ectopic testicles. Ectopic is abnormal thing which is going on a rogue, which is kind of like a ill. Undescended, which is a delay which is happening, which can be below of any reason that can happen. So, this is what we have to remember here in case of this particular testicles or this particular testicular error on terms of the descent error or descent of the testis error. Other thing about this particular testicles related to this particular development over here that I want to say over here, in case of the kidney development, we have seen that the kidney moves up, take the blood supply regionally. So, it starts from the lumbar region, sacral region, moves to the lumbar, goes under diaphragm, everywhere it switches the blood supply. In case of the testicles, it is not there. So, in case of the testicles, it is produced in the lumbar region and it takes the blood supply from the lumbar region blood vessels. That means the lumbar region abdominal aorta sends this abdominal aorta branch, which is known as testicular artery. You see the gonadal artery comes right in front of the lumbar region, goes down all the way. It has a long course, which is not happen in case of this renal blood supply. So, renal kidney moves up, take the regional blood supply. Here in case of the testicles, it only takes the old blood supply wherever it is taken out. So it takes the same lumbar region blood supply, the gonadal artery, from its first day to the final day. And the venous drainage is likewise. Right side and the left side, the gonadal vessel drains into the inferior vena cava and this renal vein on the left side. So this is the thing which is different in case of the kidney and this particular the testicles. Both are changing the position from their development, yet they are not changing the blood supply in case of the testicles. The third most important out here, which is more clinically relevant. Likewise, the blood supply, the testicles takes this particular lymphatic drainage from the lumbar region. Now this is what that makes these things difficult for us. Now that means if the testicles have got infections, it drains the lymphatic to the lumbar region. The scrotal region do not drain this particular lymphatics from here. So if you have a testicular error, the scrotum do not show any change whatsoever. So the swelling on the testicle disease will be revealed on the lumbar region, which you cannot see unless until you take a X-ray, you take an ultrasound or take a deep penetration like MRI or CT angiogram. Now what does it mean? So in case of the carcinoma of the testis, we call them a seminoma testis, there is enlargement of the group of lymphatic, we call them as lumbar lymphatics. Why lumbar? Because they are how the testicles were produced. The testicles was born in the lumbar region, it supplies or takes this lymphatic from that region. So that's why it drains to the same old region where it have produced or where it has developed. So this is what clinically relevant in case of the seminoma testis. They give a clinical question, explain why. In case of the tumors of this particular testis, there is enlargement of the lumbar lymphatic groups. Explain why. So this is same thing that is related to the development of the testicles, which is quite difficult question, but see that all the clinical questions are getting difficult day by day. So this is the relevant thing related to the development of the kidney, the blood supply and the lymphatic drainage to it. You must pay attention over here. The whole course of these things which I have narrated in the beginning, the whole story, how testicles form, how this ovary is transformed, is not required for us. But we have to know how things are coming. Only thing you have to follow out here is that SRY gene and TDF, which determines the primordial germ cells are going to be the oogonia or going to be the spermatogonia. It's going to be the testis or going to be the ovary. So that's the main thing related to it. More importantly, you have to know this undescended testis cryptorchism. So you have to define this particular, the definitions of it and what this particular locations of this cryptorchism. That means where this testicle may be arrested or slowed in and found in which normal courses, which is lying over here. So this particular region, which is kind of the normal positions of the testicles, could be in the lumbar region, did not move at all where it is produced. It could be on the deep ring, it could be within this canal, it could be on the superficial ring, it could be high up in the scrotum. These are the normal positions of the testicles. Anything beyond this particular point is ectopic pregnancy, ectopic testicles. It may be in the femur or in a femoral region. That means it is abnormal. It may be on the root of the penis. That means it is abnormal. That means it is ectopic. It may be on the perineum region. That means it is abnormal. This is ectopic. So you should be able to have a clear understanding what do you mean by this cryptorchism and what do you mean by ectopic testicles. This is the thing that you have to carry. And please remember about the lymphatic drainage of these testicles. They drain to lumbar group of lymphatics. Why? Because the testicles are produced or originated in the lumbar region. They take the blood supply, venous drainage, lymphatic from their primitive source. It do not change the blood source, the lymphatic source. Likewise, the kidney did.